Hello, good evening, everybody. How are you doing? Great. 7 o'clock p.m. Eastern Standard Time on the dot. And I know we're all busy people, and that's why I like to start on time. And I'm bringing some friends in that are also busy people. So, who am I? I am Yvette McQueen MD. Um, Emergency physician and travel doctor, a global physician on a mission to educate about health, travel wellness, and disease prevention. So I'm coming to you today because guess what? We're out. The COVID vaccine is out. And yeah, I'm getting a lot of information. A lot of my friends are getting theirs. I'm so jealous. I can't wait to get mine. But I wanted to bring some other friends on to let as we're doctors, but we're also busy moms, dads, doing things. So that's why I want to get started about the COVID-19 vaccine. And one of my BFFs, she's riding her car, but she is here to give us information. She is one of my best friends, and she's an awesome triple boarded infectious disease doctor, Dr. Alexea. Hey, Dr. Alexea, are you able to hear us?
Hey, Yvette. I am having a technical difficulty, so if you and your audience can just be patient with me. I had to pop off, and when I bounce back on, I guess my phone is recalibrating StreamYard, so I apologize.
That's all right. We can still hear you, though.
Okay, perfect. You guys can hear me. I missed a good portion of your introduction because I couldn't hear you, but now I am able to hear you.
Okay, yeah, I was just saying that that we want to talk about the vaccine, get the information out to the people, want them to know what's going on. So once again, I introduce yourself.
So I am Dr. Alexea. I will show my face here shortly. I am a triple board certified infectious disease physician. I am boarded and trained in internal medicine, general pediatrics, and adult infectious diseases. I'm also a breast cancer survivor thriver and a mom and a frontline worker. And I have taken care of hundreds of COVID-19 patients in the early part of the pandemic, and I am have been anxiously awaiting the vaccine or the vaccines, and I'm excited to talk about it. I think for so many communities, but especially ours and especially vulnerable populations, it's important to consider all of the information and to hear different perspectives on it. So, I'm here to support the conversation. I'm here to give my perspective. In no way do I want to be like coercive or force my own personal opinions on it, but I do want to give an expert perspective because there's so much misinformation. There's so much, manipulation of the data. People are, taking little bits and pieces of the truth and facts and twisting it up with lies. And, people are falling for it. And that's not to say that there's zero risk in taking the vaccine. Certainly, we're not saying that, but you want to make an educated decision, you want to make an informed decision, and you want that decision to be based on the actual data.
Exactly. So we only have Dr. Alexia for a short time because, like I said, she's a busy mom. She's doing her mom errands that we all know about. If you have questions, put them in the chat, and I can tell her about it. But we're going to start on about I'm just going to start talking about it, and she can. But this also dispels some of the myths as we talk about it. So the two vaccines that's now out for COVID-19 is the Pfizer and the Moderna. Those are the two that has been approved by the FDA. And everyone always talks about they were done so fast, and I'm trying to tell people they weren't done so fast. Don't
Not
you
at all.
agree?
I agree. They weren't done quickly. You know, One thing is this: we don't even usually have privy to the timing of vaccine production, right? We never watch it unfold. It's never a political event. There's not usually as much crisis around it. And, people have to remember that vaccine technology itself is not new, and that some of this information has been being researched for years. It's just the application for vaccination against COVID-19 is what's new here. So some of the vaccine candidates, not necessarily the two mRNA vaccines, but I know for the AstraZeneca vaccine, for example, they were already researching a vaccine product for plain old boring SARS, right? Avian flu, and then that was not a pandemic. So they took the information they had and the knowledge they gained in the production of a vaccine candidate for SARS 1 and applied it to SARS 2, which is what we know as COVID-19 infection. So a lot of the baseline information and data is not new technology, it's not new areas of research. It is just newly applied to the COVID-19 vaccine. And then apart from, we know how to make a vaccine, we've been doing this for years, and some of this research has been ongoing for years. When you're doing a vaccine, right, or when you're doing a vaccine trial or any clinical trial for that matter, you have to reach a clinical endpoint, a defined clinical endpoint. Well, the defined clinical endpoint was when there was enough people in the trial who developed a COVID-19 infection. Well, when you're diagnosing, a million cases a day around the world, it does not take very long to reach your clinical endpoint.
No, not at all.
So,
I'm telling people that most studies only have like 400, 500. The
exactly.
Pfizer had 20,000 people and Moderna had 30,000 people.
hmm And they're still studying. They still have ongoing research. They're still investigating. It's not like they said, all right, we got our data. We're done. We quit. We're tapping out. They said,
Right.
okay, we have our data. This is what the statistics are showing us for this trial. And we're going to continue to follow this cohort of patients for the next 2 years. So, I think that's an important point, and I think that's a great thing that they're doing, opting to continue to monitor and follow the individuals who took their vaccine and see what happens to them over the next 2 years, given the circumstances.
Right. So I like to tell people that
Hey, y'all.
that the vaccine usually and I never have my whiteboard to do it. But so yeah, how a vaccine is made. So usually it's like, okay, we're going to study this and let's do the preliminary research. And
Mm-hmm.
now let's do the study. Let's get like 20 people to do it. Okay, now we know. Now let's get us like 500 people. Okay, now let's get it. Now we need some money to do it. And then it's like, okay,
Exactly.
now we need approval. And people don't understand. Sometimes it takes 6 to 8 months to get an appointment with
Yep.
the FDA.
Yep.
When they it's usually like this. It's usually like, oh, this. Well, when they say fast track, what I know that especially with the Moderna, but also with the Pfizer, they's like, oh, we got plenty of people. It's a pandemic. Lots of people can sign up. So they had
Yes.
the first study. They did do a few people, and then they said, let's do 2 and 3 together phases. So they started doing it like this,
Yeah.
stacking it up at the same time. They're like, okay, we got our information. Let's call the FDA. FDA was like, can we meet tomorrow? I mean, like
Exactly.
usually it's 8 months. They're like, can we
Right.
meet tomorrow?
Yeah.
And the other difference is production. So
Yes.
usually,
That's the most important point.
right, because production could take another 6 months to do, where they did not wait for approval. So if
No.
they had like did not get approval or the test was not good at all or the vaccine wasn't good at all, they would have risked losing millions of dollars because they produced it before they knew it.
That's right. But imagine how up in arms we would be if these vaccines got approval and then we said, okay, but we need 6 to 9 more months to produce enough doses for everybody, you
Right.
know? So a lot of people have it that, like, oh, the government. paid for these vaccines and we can't trust it because the government paid for it. Well, no, some of these were independent operations. Some of this was research ongoing. Really, all the government did was pay for us to get the doses once they were
Right.
available, you know?
Right. And that's why Pfizer is short, because they prepaid for some, but they
Mm-hmm.
didn't trust them all. So Pfizer's a private company. They're like, we're giving it to people who paid us. And
Mm-hmm.
that's why they're like, well, this is all the government, your US government bought. And that's
Yeah.
why UK got it first.
Yep.
Now, coming back, now everybody that's joining us on, I'm letting you know this is Dr. Alexea, who is infectious disease triple boarded. Awesome. I call her the Black Dr. Fauci.
I love that. Thank you.
But she is awesome, and she's just giving us a few minutes of her time. So I'm gonna get into the other myth that people
Yeah.
say, it's gonna rewrite our DNA because it's mRNA. Let's go all the way back to science,
Yeah.
biology,
Listen.
ninth grade, 10th grade biology. So
Yeah.
I know some of us slept through. I love it because you know what? This is like nerd city. All
Yes.
hands out to nerds and
Yes.
scientists. This is like, I'm loving it.
It's our
So,
time.
yeah, so biology, remember you had that biology in the cell, and I probably should draw it. So let's see if I can draw. You
Yes,
got
please do draw it. Because when I've done any lives and I'm talking about the cytoplasm, I'm like, the cytoplasm is the body of the cell. And that's where the action is happening with this vaccine. Your DNA is in the nucleus of the cell, that little circle in the middle that Dr. Yvette drew. So the mRNA cannot get into the nucleus, nor can an mRNA insert itself into your DNA. That is why the vaccine is not, that's not an RNA virus, but the mRNA cannot transport itself into your cell's nucleus. It doesn't have access to the DNA. It doesn't have access to your genetic code. It can't get in there. mRNA does not insert itself into DNA. So your genetic code will not be rewritten. You will not be programmed to be some slave that is going to, operate and do tasks on somebody else's command. Like, these things just simply are not true. They're not possible. And
no.
the folks who were doing this took that into consideration. You don't want to vaccinate the population, but then turn around and, find out you manipulating their DNA and everybody's running around making, I don't know, spike proteins indefinitely. That's not the deal here.
I know, I know. So it's just like, so right, the virus is an RNA type virus. Its membrane is made of RNA. And that's why I say it's very unstable. Washing your hands with soap and water actually kills it, which is great.
Right.
Washing your hands is great. So the messenger RNA, and I know people heard that some of them are nanoprobes or the new technology of
Yeah.
nanoprobes or whatever. Man, that makes it get into the cell. That's like a carrier.
That's it.
That's like the grocery bag. Okay.
That's
That's what
it.
that is, if you think about that. And so then the messenger RNA is actually just when we say it's a code, what they did was, so you're not getting a virus. You
Right.
do not get the actual virus.
Right.
They copied the protein. You know, when you see the pictures in that little spike thing, that's the spike protein off of SARS-CoV-2. That's the actual uh, definition of COVID-19.
Mm-hmm.
And it just copied that little spike to say, here, messenger RNA, take it into the cell. And so when you get into the cell, our immune system is so wonderful. So someone had put it before that the immune system had B cells and T cells. So the B cells said, what's that foreign? Who's that on our yard that's not supposed to be here? Let's get them. Boom, 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 boom. And they're like, okay, T cell. T cell is the memory cell that always remember, and that's how your antibodies are made. So that if it comes, so if you're exposed to it and that virus gets in your cell again, that T cell be like, hey, I remember you were the
Mm-hmm.
bully, the bad guy. We're going to get you before you could even get to us.
Exactly. You're not from around here. You don't belong here.
Mm-mm.
You know, and so it primes our immune system to fight the virus as soon as it sees it. And it makes sense to go after the thing that the whole virus is surrounded by, the thing that allows the virus to insert itself into our cells and set up shop and cause an infection. It's genius.
I know.
We don't
And then
respect genius anymore, though. Not me, not you, but just society does not
I know.
respect science as fact.
Science, that's it, science. And too, the messenger RNA, like you said, it was studied before for SARS and MERS. If people think back 10 or 12 years ago,
Right.
the SARS and then there was the MERS from the Mediterranean, they were respiratory diseases. And they start studying them back then for a messenger RNA vaccine. But guess what? They didn't have the money for it, and they didn't have the population of people to study it on.
That's right. Those viruses weren't as transmissible human to human. And so we didn't see those infections as much. And there's less of an importance for an infection that only is impacting a very small finite group of people in one
Right.
place. You see the infection very frequently. It's not causing any financial devastation. It's not shutting down cities and states and countries and continents like this is. So when people argue like, oh, why isn't there a vaccine for the common cold? Well, first of all, the common cold doesn't, there's financial impact, but it doesn't cause financial devastation on the level of shutting down whole industries, interrupting trade because, things can't go out on ships, interrupting tourism, all of those things. Yes, people got common cold. Some people take a day off from work, but the reality is we take cough syrup, Tylenol, Motrin, and go to work. We take cough syrup, Tylenol, Motrin, throw our children back in school when they got those cooties from, and we move on. So what is the big investment in something that is a nuisance in
Right.
comparison to something that is devastating every aspect of our lives, including life itself?
Exactly.
So there's a huge difference. And this is one infection. Common cold is so many different types of viral infections. And, you can't make a vaccine that is going to fight rhinovirus, plain old boring coronavirus, human
Adenovirus.
metapneumovirus, para-influenza. Like, I could go on and name a whole lot of viruses, but I think y'all got the point.
Exactly, exactly. So yeah, so it was not rushed. It was done in organized fashion. It was done according to science. They just had a little bit more backing with money because, like she said, because it was interrupting basically basic life. And your DNA is not written. You do not have. No one's inserting a microchip into you
No.
with the vaccine. Bill Gates don't own you. It don't own the vaccine. I mean, I've heard like several things this weekend
Yeah.
about the vaccine, but your immune system is working great because it activates the B cells and the T cells, memory cells, so that when you are approached with it. So when you get the vaccine, so there's two different vaccines that's been approved, right?
Mm-hmm.
The Pfizer and the Moderna. Tell us the difference between the two.
So there's not a significant difference between the two of them. They are both mRNA vaccines. And for me, as a nerdy science person, I'm like, this is great, right? Because when you write a research paper in order to prove your theory, right, somebody has to take the same steps and get the same outcome. So the fact that these two companies came up with the same or very similar vaccine technology and they got nearly identical results, that tells me that this is real, this is factual. It was proven by two independent groups using the same or similar methods, and they got the same outcome.
I know. So yeah, so let's see. Pfizer was 95%, and Moderna was 94.5%, 95%. So when we say efficacy, that means how effective was the vaccine from preventing, not preventing you get it, but actually have you get ill. So the vaccine is actually, the myth is that you won't get it and we can stop wearing a mask. So
No.
no.
And
Oh,
it's
no,
it's
no,
more
no.
than just about the person who got the vaccine, right? Because you can basically become an asymptomatic shedder of the virus, right? If
Mm-hmm.
nobody else around you is vaccinated, right? You get the virus, however you get it. You inhale it, it comes in through your eye, you didn't wash your hands and you touched your face, however you got the virus, right? It colonizes your respiratory tract, but because you're vaccinated, you don't exhibit symptoms, you don't get critically ill, you don't die from the virus 94 to 95% of the time, right? There's still that very small percentage of people who's going to get caught out there because it's not perfect. But by virtue of you not getting sick, if you don't wear your mask, you are like, oh, I feel fine, I'm good. You go out and do what you're doing. And if you're just talking like me and Yvette, if we were talking to each other in the room, we'd be breathing respiratory airborne particles all over each other, doing some little spittles and respiratory droplets, and we'd be spreading COVID everywhere we go, even though we don't get sick. So you still are in a mask because you still need to protect everybody around you. And we're not anywhere near achieving herd immunity because we don't have enough doses yet.
Right. Right. Oh, definitely. I think was it 75% of the population of basically the world population. We won't get there for a while because the doses. So yeah, we the Pfizer. You're gonna have to have 2 doses of each.
Both
The
of them
Pfizer is 21 days apart, and the Moderna one is 28 days apart. So another myth out there, and unfortunately, I heard this from some governor somewhere that maybe just 1 dose will be fine.
What? No.
Yes.
No. So the thing, vaccines are like medications, right? You have to take them as prescribed. You have to complete the full dose in order to get the maximum benefit.
Right. So if they saying if you get the first dose, you are basically covered about 50%, half and half. Once you get the second one, you covered that 95%. Do I want to give someone give me 50% versus almost 100%?
Right.
Give me 50 cents instead of $1.
Exactly.
What?
Give me my 2 shots. I'll take 3 days off if I need to recover from whatever, achy arm, feeling achy or fatigued.
Right.
Whatever it is, for me, I'm here for it.
Yeah.
I'm taking the chance to avoid dying from this virus.
Don't give away your shot. Is that what they say? Don't give away your shot. I know. So you need the 2 shot. Now there's a couple more on the stream. AstraZeneca and Johnson & Johnson, isn't it coming up?
Yeah, AstraZeneca is close. They were the ones who early on there was a case of transverse myelitis in one of their study participants, and it turned out that this woman had autoimmune disease. I believe it was MS, and that was more likely the cause for her transverse myelitis. MS does cause transverse myelitis, one of the more common causes of that. And so they had a pause, and then their vaccine is still, their stage 3 clinical trials are still underway, but I think they will probably be number 3 to come to market and get FDA approval from what it looks like. And again, when people are saying, oh my God, they rushed it, yada, yada, yada. They started out with like over 100 vaccine candidates. There was 13 strong contenders and then I think 7 of those are in phase clinical trials right now,
Right. So if anybody's out there and have questions for us, just jot them down. I'm also watching the Facebook thread. So if you got questions, just come on and just jot down your questions either there or in StreamYard. So, and Dr. Alexea, the infectious disease doc, yay! She's been with us. She's gonna have. I know she's
Yeah.
gonna have to go soon because
Yeah,
she's
I'm gonna hang around for as many minutes as I can.
okay.
Kennedy Rose might join us on the chat. You might see the car move, but listen, I'm here.
Okay, yeah. So, yeah, some people were looking out there. So, like I said, I'm jealous of all my friends, doctor friends. That's like, I got my shot. I got my shot. I was like,
Me
okay.
too. I'm like itching to get mine. So I work outpatient, right? Even though I'm an infectious disease doctor, I'm an oddball of an infectious disease doctor because I don't make hospital rounds. I did do hospital rounds in the first wave of COVID-19, and I agreed to come back and do hospital rounds in the second wave if I needed to, or if they need me to, right? If the numbers go crazy. Um, but the difference between the first wave and the second wave is now I have a COVID machine in my office. I can test and do rapids. Now we have a handle on things. So we are allowing patients to come into the office with respiratory symptoms. Whereas before it was like, oh no, don't do that. And that
Stay
was
in the parking
because,
lot.
yeah. So, testing in the office, seeing sick patients is still cough, cold, and flu season as well. So you have to test
Hmm.
and rule out those things. And so I'm being exposed every day, whether
Mm.
I know it or not. Sometimes I know it, sometimes I don't. And so for me, in the beginning, I'll be honest, when there was just talk of the vaccines and there was nothing had any emergency use authorization, when people would ask me, I would say, if you're high risk, I would strongly suggest you consider it because of X, Y, and Z, right? I would give the expert opinion answer. And then people would say, well, what about you? Like, are you going to take the vaccine? And when the numbers were low and it was summer and we could be out in our backyards and patients weren't coming in the office, I was like, well, I wouldn't be the first person to take it, but I certainly wouldn't be the last. And that's the
Right.
thing we say in medicine when there's like a new blood pressure medicine on the market or a new cholesterol medicine or diabetes medicine. But those things, you got years before they take you out, usually, right? When you talk about mitigating risk and decreasing risk factors and all that stuff. But when you're talking about COVID-19, when people are here today, gone tomorrow, and the numbers are rising and the cases are up in your face, and there's something real and tangible to do about it, it's very easy to say, no, I want my vaccine yesterday. I emailed the administrators. I want to know, when am I getting my dose? And they're like, well, yes,
I
you're a
know.
healthcare worker and you're front facing, but you're not in the ER or the ICU. So we're going to get to you, but we got to get these people vaccinated first. And I
I know.
totally understand that, right? Me swabbing somebody's nose is different than these guys intubating people, bronching them, putting central lines in them, lots of close face-to-face contact.
Right.
When
Yeah.
I'm in the exam room with my patient, you sit over there on the exam table. I'm putting my rolly stool in the corner. I'm gonna stay far away from you while I'm talking to you. I'm gonna do this exam as expeditiously and completely as I can, and we're gonna get on out of here. But that's not the case for the ER doctors and the
No.
ICU
Mm-mm.
doctors. So, I got, as much as I'm like, hurry up and give me mine, I have to respect that.
Well, that's how I'm feeling. So, it's like I'm an ER doctor.
Mm-hmm.
And I've intubated people. I had to put the whole papper on that you see, and and trust me, I have a hard time breathing in that one, especially. But they hook you up to air. But I'm in between jobs, so right now I'm like, okay, I'm searching where to get my vaccine because
Yeah.
earlier today I was on hold for 2 hours trying to talk to
Wow.
the health department. I was like, I need a vaccine before I go
Right.
back to work. So Dr. Dietrich, she said we already addressed this. She said, should you get the vaccine right away if you already had antibodies? So if you already had COVID and
So
you have antibodies, do you need to get the vaccine?
they are suggesting that should not make a difference. And that, so some people are saying, um we don't even know because some people have gotten reinfected and been sicker the second time around, and it's not very predictable. So we don't know if there's lasting antibody protection from having the infection. So people should go ahead and get vaccinated regardless of a history of a previous COVID-19 infection. Interesting, I read some, not literature, but just like an article written by someone with some sort of medical expertise who was like, oh, people who have had the COVID-19 infection, they may have some antibodies since, we're using convalescent sera and they should have some protection and they should go to the end of the line. But being that we've seen people have repeat infections within weeks or months, there may be some consideration for still vaccinating the people who are at highest risk, even if they have already had a COVID-19 infection. So the answer to that question is not the same if you're talking about a healthy 25-year-old who had an infection and recovered back to their normal health versus, like one of my patients, 89, obese, chronic kidney disease, diabetes, high blood pressure. I thought he was going to die. He didn't die. We're not going to tempt fate a second time with him. As soon as he can get a vaccine, we're going to get him one.
There you go. Exactly. So yeah, that's another thing. Let's see. What? Yeah. Once you have it, you can get it because he said the antibody. I was told that the antibodies from the actual disease only sticks around, like you said, 3 to 4 months. But unfortunately, with the vaccine, people are asking me how many times do you have to take the vaccine? We don't know.
We don't know yet. It could be seasonal, like the flu, or it could be,
Like yellow
one
fever or something.
series and done, like
Yeah.
chickenpox or
Yeah.
measles, mumps, rubella. And even time will tell because some people need boosters for things that last other people a lifetime, and so we'll see. We just we can't give long-term answers because we don't know. But that's the beautiful thing about research, is ongoing, and we'll see.
Because I always like to tell people this is now it's a 12-month-old baby because it was only discovered December 2019. So
Mm-hmm.
this is only a 1-year-old baby, barely
Yep.
walking, barely talking, killing lots of people, but it's a 1-year-old baby.
I love that analogy.
So yeah, we don't know that much about it, and that's why when people say things was fluctuating through the year, that's because we didn't know anything about it.
That's right.
It's growing and it's developing and we have to figure that out.
Yep.
So yeah, so we talk so what side effects of any vaccine, because it ramps up your immune system
Mm-hmm.
and it does things it's supposed to do, because people like, oh, I felt achy afterward, or I got a fever or something like that. Even when you get the
Yeah.
flu shot, that's your own immune system. But what about these other side effects people are talking about? And I got my theory about it.
Mm-hmm. So, people claiming that it can make you infertile and sterilize you because one scientist remembered some antigen on the uterine tissue that looks similar to something on the virus. Is that going to be an issue? Well, in theory, you can theorize many things, right? But in one of the clinical trials, I can't remember if it was the Pfizer or the Moderna, 23 of their participants got pregnant after taking the vaccine. So
Pfizer.
clearly that's not the issue.
No,
That's not an issue.
exactly. And the side effects, people like, oh, well, I got a rash, or, they got because it's usually, they said 1 out of 1,000,000 gets it, in
Mm-hmm.
any vaccine, and that's what's occurring. Guess what? People have all of a sudden have allergies to food. They didn't realize. All of a sudden
Right.
they ate something, they got an allergy. A friend of mine the other day said people have allergies to semen. And I was like, ooh, oh,
Yep, they sure
okay.
do.
Okay. So yeah, so people will get some side effects, and there's one question here. We're talking about the vaccine, but I'll answer this question real quickly. What about the cocktail you know who got? Is it possible to receive that versus the vaccine?
So I think people have to remember that, even though he got socialized medicine, he got presidential socialized medicine. The likelihood of somebody getting all of those things, he got, we're assuming remdesivir, the Regeneron, which I think was a monoclonal antibody, and then
Right.
convalescent sera and some Decadron. First of all, I can't even get Decadron in my office. Like, it's on back order. So is your hospital going to have it? Hopefully, because it is one
Yeah,
of the things we can use to treat hospitalized patients for
right,
COVID-19, but it has other uses. But most people are not going to get all three of those things, right?
right.
You'll get something if you need it.
And as my critical care friend said the other day, the monoclonal only works if it gets it early on in the process. Because
Yeah,
she's
you
like,
have
I
to.
think, yeah, she
You
said
have to
she
give
throws
them.
the stink at sometimes the patients and it still doesn't work.
Yeah.
So once again, everybody that just joined, go, hey,
Say hi, K
hey,
Rose.
Rose. Everyone that just jumped on, I have Dr. Alexea, who is infectious disease, triple boarded doctor, internal medicine, peds, and infectious disease, and she's been gracing us with her presence while she's doing her motherly duties. Aren't you
Mhm.
just like this? As scientists and doctors, we're doing what we need to do to get the
That's
information
right.
out to the public. And
Yep.
why we wanted to come to you and bust some of these myths that's out there. So, we said it's not going to rewrite your DNA. Your immune system is going to work effectively. It was not rushed. We told you about the two differences. And yes, you need both doses. Don't get 50%.
Yeah.
Get both of them to bring you up to 95%. Okay.
Yep.
And you don't get COVID. We're not giving you the actual virus when we
Right.
inject it.
Right.
Anything else you want to add?
I'm trying to think what other stuff we talked about.
Oh, who can't take it? That's it. Who can't take it?
Oh, so who can't take the vaccine?
The ones
Um,
that's out right now.
so right now, children, because they weren't studied. Pregnant women were not studied. However, my understanding is that will be at the discretion of the obstetrician gynecologist and the patient, right? This is more of like an informed consent type of
Right,
situation
because the
here.
American College of OBGYN said it wasn't studied. We don't know the effects during pregnancy, but if this pregnant woman is at high risk, she out there, like you said, intubating the patients in front of them
Right,
every day. Do you want to consider her getting it versus the vaccine?
right.
So, but that's a discussion they have to have together, the doctor and the patient.
Yeah, the same was true for breastfeeding women, right?
Mhm.
Doesn't
Right,
cause an active infection. There, nothing should be transmitted to the baby, but it should be a conversation around it.
right,
And when I think about it, I'm like, I don't tell women not to breastfeed when I give them flu vaccines, or we give pregnant women Tdaps when they're rolling out the hospital postpartum. Just have the baby, and we don't say don't breastfeed. So, but again, it should be a conversation. It's an important conversation to
look
be
at your
had.
little one back there putting on her mask. You go, girl.
My baby knows. She
You
knows.
go, girl. You go, girl.
Listen,
Right. And
parents,
if you
model good mass behavior. Your children are watching you. If you act a fool about putting a mask on, what do you think your children are going to do when
exactly.
when they go to school?
Exactly. Very good. And that's just it. You have to so yeah, that's the other myth we say. If you get the vaccine, do you still need to wear your mask?
Yes. Yes, to protect
Yes.
others around you,
Yeah.
because everybody's not going to get their vaccine all at the same time.
Yeah.
And the same way we're staggering it in departments within the hospital. That's probably going to be the case for households. If people have really severe or moderate side effects, they're really down and out for 2 or 3 days. You don't want to take out the two people in the household who are taking care of everybody or taking care of one another. So you would stagger the vaccines. So, for different divisions in hospitals, they're staggering vaccinating their staff. They're not vaccinating all the people in one team all at
Right.
once.
Great. Well, Alexia, I'm so glad you could join us, Miss Infectious Doctor Infectious Disease that you are. I know you're actually doing a talk later on tonight at 9:30. Where can,
Mm-hmm.
if they want to hear you again, where
Absolutely.
can they hear you?
Yeah, so I'm so passionate about having this conversation. It's a very important conversation to have about who should get the vaccine and to bust up these myths, all of these myths that I've been hearing, all of these lies, all of these little bits and pieces of truth mixed in with stuff that makes absolutely no sense is what prompted me to want to get on and lend my voice to this conversation. So I'll be doing that on my Instagram page. My Instagram page is at Dr. Alexea. You guys could see it. I typed it there because I knew you would ask, Dr. Yvette, and I appreciate the plug. So at Dr. Alexea, DRALEXEA on Instagram at 9:30 p.m. I'll be going live. I'll be having a very similar conversation and, looking for people to bring their questions and their concerns. It's important to know what other people are thinking. It's very easy for us as healthcare professionals who are informed, who can dig back to our ninth grade science and understand why the mRNA can't get inside of your DNA.
Let me show that picture again. Here we go.
But,
I it's upside down. Here we go.
Yeah, under the stress of all that's happening on in everyday life, people may not remember that. They remember what they're getting beat over the head with in the news or on their internet feed or news feed or in their inbox. And so, I think it's just as important for those of us who are in the field, on the front line, seeing the patients at risk ourselves, and fully understand the data behind the vaccine. And that's the data that is available to us, right? We're only privy to what we're privy to, but we need to be a part of this conversation too.
Yeah, and I was told the other day that since the pandemic that medical journals used to be where we had to pay a subscription to get them online. They all been free. I've been going on reading them, and I did 2 webinars on it this week. Like, let me read up on it because I know, I'm still getting my shot, but I'm still reading on it so that when people come to me, I can actually be knowledgeable, that I can actually give them the facts. Yeah. So great. Thank you. Thank you
so much for having me on. Have a great rest of your life, Dr. Yvette.
Okay.
I can't wait till we can travel again.
I know, my traveling buddy. We'll get there, girl.
Yes. All right. You have a wonderful night. Bye, everyone.
Bye, K-Rose.
Say bye, K-Rose.
Bye. Bye. Okay. So I'm just going to review some of the facts that we actually talked about. I was talking with an infectious disease doctor, one of my BFFs. We're just going to review some of the facts and debunk some of that myth. Once again, this vaccine for COVID-19. Remember, COVID-19 real name is SARS-CoV-2. It is a SARS virus, respiratory virus. SARS virus and MERS viruses, they were being researched years ago, 10 to 12 years ago when they were out, remember. And they actually, so they start researching about mRNA vaccines back then. But as in much research, they didn't have the money for it. They didn't have the research. They didn't have the number of people. So during this pandemic, lots of people they can use to study. The Pfizer used 20,000 people, while the Moderna used close to about 30,000 people in their study. Most of the time, we may get tops 5,000. Usually it's in the hundreds, which is great. And once again, it was not rushed because the way vaccines are usually done, they're studied over years, but it's usually, okay, we're going to study the part 1. Now it's part 2. Now it's part 3. Okay, let's make sure it's right. Let's get if we're gonna go to the IRB board or FDA, you're gonna have wait 8 months, 6 to 8 months for an interview, discuss it, go back, look at that, come back a year from now and give us more information. And then after the vaccine or medicine is approved, you got to wait 6 to 8 months to get it produced. So the difference of this one is it's a pandemic. And like Dr. Alexea said, it's not only affecting lives, it's affecting the world, and it's affecting the economic structure of the world. Money's in it. So what they did it all together. Phase 1. Then they did 2 and 3 together, and they had enough people. And then they're like, okay, we need to take it to the FDA. And FDA says, okay, can we talk tomorrow? So they didn't say come back in 8 months. And then they also, what they did was they did the production at the same time as they did the research. So they took the risk because it could have been like bad research, bad vaccine, but they was trusting their science and they produced it so that as soon as it was approved, they could put it out. Now, once again, well, I'm gonna show this picture again. Let me put it upside. It does not change your DNA. Messenger RNA is a code. It took that spike and that spike off of that COVID. You see the pictures of it. It's called a protein. That spike protein. It read the code. It read what it is. Put it on the messenger, and that's why we call it a messenger. It's like passing a message into the, and that's what's in the vaccine. And your immune system, the B cell, said, "Hey, who is that? You don't belong here on this block." And then they say, let's get him. And T cell is your memory cell. And they tell him, make sure when he comes back, if he come back, we get him early so they don't mess up the rest of our cells. And that's what it does. That's what our immune system does. Once again, see this? This is back to biology 101 in 9th grade, 10th grade. You have your cell, your nucleus is in the middle. Your own DNA is right in the middle. That messenger RNA is just giving information inside that cell so that the B cells and the T cells can gobble it up. Okay? That's what the messenger, it's not touching your DNA. It's not rewriting you. It's not making, like she said, it's not making you a robot. It's not giving you, we're not injecting nano chips into you. When they talk about nanos, that's actually a very small molecule that would actually carry it. Like I said, it's like the grocery bag is actually carrying it. So, and there's 2 different vaccines that's been approved right now. It's the Pfizer and Moderna. Both of those are the messenger RNA ones. The only difference is how it's stored, which you don't have to worry about that. And that you need 2 doses of each. The Pfizer one, 21 days apart, and the Moderna one, 28 days apart. Do you have a choice of either one? No, you don't. It's whatever's in your area, what they choose to give you in the area, whatever is distributed to your state or your hospital. But you should not take one Pfizer and one Moderna. You stick with it. And they're actually giving a card. Like I said, I'm watching all my friends get it. Jealous! I want mine! And they're giving you actually CDC card if you've ever gotten like the yellow fever one or some other international vaccines. They're actually giving you a card, and people they're making the appointments for your next one after that. So that's the difference. There's some other vaccines. I think there's 5 other studies out there, and some other ones coming up in the spring. AstraZeneca and I think it's Johnson and Johnson, but they're using a different type one, adenovirus. But we'll talk about that when that comes out, okay? Because right now it's the storage. They want to get the healthcare workers, the frontliners, the front facers, the long-term facility workers, staff, and those are high-risk people they need to get first. So they expect the general population won't be getting it out until March, April, May, in the springtime. Side effects you get from when you get your vaccine, people are getting a little sore arm. You may get a little achy, feverish, kind of, even when you get the flu vaccine, you get that. You're not actually getting the virus. That's your immune system working. So when you have those symptoms, that's actually your immune system working perfectly, just like it's supposed to. Now, some people have allergies, like with the flu vaccine. It's like if you have allergic to eggs, you may want to skip it and try another form. So because we don't know, it's a new vaccine. We don't know if people can have allergic reactions, and that can actually be taken care of at that time. And that's why it's given in a facility, so that you can sit there 15, 30 minutes and they watch you and see if you actually have allergic reaction. Do people have allergic reactions to vaccine? Yes. Do people have allergic reactions to food and other things too? Yes. So it's people, that's your immune system. It's a person-to-person event. So the myths: it does not change your DNA. you should take both doses. Don't take, if you're only 50% effective the first time, you need it to be 95% effective. You still need to wear your mask. So you can, what it is doing is you may still get it, but you won't be as strong or severe. Like I said, 95% effective. There may be one or two, out of 30 million people in the world, there could be something else, but it's you get it and you definitely know you're going to be bad and get it severe and die, or you can get it and just have mild symptoms because you took your vaccine, or you may be asymptomatic. And that's why she said you can colonize, or that virus can be like up in your respiratory passages. And that's why you still need to wear your mask. And while I got you here, let me pull this out. Wear your mask, people. That's why we need to cover the nose. Full nose exposure, not down here, not down here. You need to cover your nose with your mask. So you're still going to need to wear your mask, wash your hands, social distancing, even though you have the vaccine, because everybody is going to be staggered and everyone has not been immunized just yet. And it's an unstable virus, so washing your hands with soap and water works. It kills the virus. So that's most of the myths that I'm telling you about. We don't know if you're going to need to have it again right now. Once I said COVID-19 is a 1-year-old baby. We don't know a lot about it. It's just walking, just barely talking, just moving about, killing lots of people. And that's all we know about it, really. So we're learning more each month, and that's why things change. So no, we don't know if if it's going to be a yearly virus, or if it's going to be every 10 years, like some of them, like shingles, or if like yellow fever, you don't have to take it anymore. We don't know if that's the vaccine. Right now, it was not studied in children 16 and under. So 16 and under for Pfizer, and 18 and under for Moderna, they're cannot take the vaccine. Those are trials and studies they have to do. With pregnant women, they say that's a discussion with you and your OBGYN, and discuss your risks that you have. Because in one of the study, the women started off and then they became pregnant while they were actually in the study. So they know that some women can get pregnant doing it. So it's not sterilizing you either. So I hope that answers your questions. Let's see, there's like another comment up here. So I hope I answered everybody's questions. I said, jot the questions in as you can. And I appreciate you sticking with me. Wow, I've been on here almost an hour, but it was a great thing that the infectious disease doctor can join us. And if you did not catch this live and you're catching the replay, great. So you do that, catch the replay. And if you still have questions in, throw them in, and I will be checking. Just put hashtag replay, and I will try to answer the questions. I think I got all of it, the effectiveness, the dosage, yearly, who can take it. So I am so happy all of you could join me. Is it less likely? Someone said they had another question. Is it true that someone asthma is less likely to get COVID-19? No. COVID-19, actually, people with asthma is actually at more risk for it to affect them, because you already have respiratory problems and it's a respiratory disease. So you're actually more at risk by getting COVID. Has no discrimination. It doesn't be like, oh, that person is like that and I don't want them, or that person is like that. No, COVID has no discrimination of who is going to be attacked. It's all about exposure. So I would, once again, taking the vaccine, we're not forcing anybody. We just recommend it. I'm glad you saw the article, but sorry, you're more at risk. We're not forcing anybody, but this is coming from the healthcare professionals. We see the COVID and the actual results of it every day. So that's why we coming to you. I trust it. Like she said, I can't wait to get mine. She can't wait to get hers. So we are going to get it. We trust the science. We trust the science. And that's what I wanted to come tell you about. So again, jot down your questions, #replay, let me know. And I am here. Okay, once again, who am I? I'm glad some of you joined me, jumped on. If you don't follow me, follow me. I am Yvette McQueen MD, emergency physician and travel doctor, along with a wellness lifestyle coach, a global physician on a mission to educate about health, travel wellness, and disease prevention. So if you want to, let's see, this is my website. You can follow me at, and I'm pretty basic, YvetteMcQueenMD.com. You can follow me. And like I said, I do wellness. And if you want to grab, I've been telling people about wellness and stress management during the pandemic, because it's affecting us all, whether we believe it or not. If you're waking up in the middle of the night and having insomnia, the pandemic is affecting you. So medqueenwellness.com, you can get a free PDF that talks about wellness and stress management. But remember, YvetteMcQueenMD.com, Facebook, LinkedIn, Twitter, and Instagram. It's a little different, but you can still find me, Yvette McQueen MD. All right. Hope this was great information for you all. And peace and love. Stay safe. Wash your hands. Social distance. Please wear your mask. Stay safe. Peace and love. Okay? Ciao for now.